and of course put their question through the chat box, and then what we'll do is at the end of the session we can then I'll go through the questions and summarize these for everyone, and we can have a chance to have a discussion. I know that obviously Annette and Mehmet have one or two questions within their own presentations which they will pose to you during their time speaking. So what I'll do is as well, if you have any input on those as well.
Okay, thanks. So we rehearsed this yesterday, but first maybe I should introduce myself. My name is Annette Fagertun. I work as a researcher at the Center for Care Research in Norway University of Applied Sciences. I am an anthropologist, and my research mainly focuses on the welfare regimes and the work in the welfare regimes and the services, especially in the health and care services. So I have been made the presenter, and I should share my screen. And then if I do, like, I'm sorry, I have not done this before, so please excuse me if, can you all see my screen? Is it okay?
Yes, yeah, we can see you.
Okay.
Good.
Yeah. So then today Mehmet and I will discuss and present our thoughts about interprofessional collaboration in research. So I will give a presentation for about 15 minutes, and then I will give the floor to Mehmet. I have prepared to talk about these 4 points: the rationale of multi-professional research, what is the aim of it, and central concepts, experiences of cross-collaboration in research, challenges and opportunities, and projections for the future. And collaboration in research is oftentimes talked about in different ways, like interprofessional, interdisciplinary, multi-professional, cross-professional, trans-professional. So there are different models, obviously, for collaboration in research. But when we planned this webinar, we met actually a confusion in this regard, because Didrik, he suggested that we should call it interprofessional, while me, with my background as a social scientist, I intuitively called it interdisciplinary research. So we sort of were thinking, do we mean different things by these two concepts? So in health science, interdisciplinary oftentimes refer to a combination of subdisciplines in medicine. That is, the term in a sense has a specific connotation, and the concept of interprofessional thus emerges as a broader and more inclusive term in referring to research collaboration in the field of primary care. But in the social sciences, the concept of interdisciplinary refers to the array of different schools of thought, such as anthropology, archaeology, psychology, medicine, and so forth. So these are known as different disciplines, while interprofessional more would refer to collaboration of professional while at work. Because it's a point that when we discuss things, we should mean the same things with the same concept. So that was just what we were planning to sort of discuss also with you in the audience, that what are your thoughts and experiences with these two concepts and its connotations? And moreover, what is or should be the term used about research nowadays that increasingly engage stakeholders, not only researchers collaborating, but several more actors? So a suggestion for me could be, should we call it interaction research? Okay, but what is the aim of interprofessional collaboration in research? Interprofessional Professional collaboration oftentimes will entail a mixed methods approach, a kind of methodology that sort of wants to promote a synergy between different epistemic cultures. So an epistemic culture, we could describe, as I'm an anthropologist, I will describe it like this, is that research is shaped and are shaped within the tribe to which they belong. So it's sort of like when you do research within your discipline, you are trained to think in a certain matter about how to go about producing data, what kind of research designs are the best for the purpose of your research, and so on and so forth. And then there will emerge different epistemic cultures, different ways of thinking about what is the right way to do research. But the aim of interprofessional collaboration is oftentimes also that we approach a complex problem from different angles at the same time, and then through this we could sort of produce a broader set of data and a better understanding of the problem under investigation. So the inter refers to a real or an aspired collaborative interaction between team members. And also the term inter ideally would refer to something that should be that the actors involved should be able to understand and discuss across professions or across disciplines. And relating to my question before, so more recent stakeholder involvement in research, this produce also new methodologies, perhaps also in the long run new epistemic cultures. For example, we have community-based participatory research, implementation research, all aimed at making research also more useful or applicable for the society at large at different levels. Yes, so I have over the years experiences of cross collaboration in research. So I've just here mentioned 3 projects in which I'm currently engaged. And in this multi-care project, which is about a multicultural staff in nursing homes, which is an increasing trend both in Europe and also in Norway. We are engaged with the disciplines of anthropology, philosophy, sociology, psychology, theology, nursing science, geography, and community work. And in this project, we have a mix of qualitative methods. So we approach the issue of services development in primary care, work in primary care, mainly through qualitative methods. Our experience is that the combination of the different types of data, either collected through field work, interviews, focus groups, interviews, as rather unproblematic and produce the synergies which we sort of planned to do when we made this project. And in this project, we also have a partner from the Nivel Institute. And so her name is Sandra van Beek, and we have done field work together in the Netherlands, Sandra and I, which was also very interesting. And we have also done field works in Norway. So this was sort of the mix of qualitative methods. In these 2 other projects, we have a combination of qualitative and quantitative methods or research designs. And we have also a mix of different kinds of disciplines. But you see, maybe the main difference is that in these projects, we have economy, and economists mainly work with quantitative methods. So I will return to that issue later on. But what are the challenges and opportunities in research collaboration? So within a mixed method approach, we can say that ontological, epistemological, and methodological issues are entangled into each other, and quantitative and qualitative designs oftentimes differ at all these levels, which means that although the researchers together explore the same problem, they might think of that problem, what it is, what it constitutes, in different ways. So the nature of the problem at the ontological level is assumed to be different. And they might also, as I talked about before, acknowledge different ways to produce knowledge about the problem. So what is valid or reliable knowledge in quantitative and qualitative approaches might differ. And in the field of healthcare services research, we have sort of the hard science, the life world science, and social science, which might understand and approach the human in different ways, as a biological organism, as a person with an essence, or as a social being, always already embedded in a range of relations and systems. And this kind of understanding will sort of produce different focuses. So I think in research collaboration, these are important issues to address upfront and discuss ways of relating to each other's research designs and data, and discuss research questions and terminology, because we cannot take for granted that we mean the same thing by the same concepts and that we address the same levels by the same concepts. So an advice, and what we have tried to do, is that we have tried to strive for methodological tolerance, but we must also recognize a sort of methodological ambivalence, because very often me as an anthropologist and the way I'm used to work, I will sort of think that that is the best way, and you have others working in different traditions think that is the best way. But actually the best way is the combination, if that is a success, of course. So we must also acknowledge that there oftentimes exists a hierarchy of forms of knowledge in a field, for example, in research in primary care. And a hierarchy also includes that there are asymmetries in power, and we must relate to this issue. So in the healthcare sciences, hard science has gained a dominant position, and this was spurred by the emergence of evidence-based medicine in the 1990s. And qualitative research, as a hand made to quantitative, as sort of a filling the gaps, is not always a good solution, because each type of method stands on its own feet, and not one filling the gap of the other, but contribute with data in its own right. And also, I think in our era, the evidence trend is also amplified or made stronger by the demand for evidence-based policy. So my message is that what evidence is different in the different epistemic cultures. And now I see I have to finish up, so I have only a couple of slides left. So if the combining or integration of qualitative and quantitative data and research designs in a project is successful, this is great, and this is what we want to achieve. Yet oftentimes this is a great challenge in project. So the discrepancy between plans and good intention and the real project as it develops may lead to disempowerment of its participants. So differences in the definition of the object of research is also a challenge. Quantitative approaches will try to limit variables in a methodological reductionistic way in order to say something about the causal interference, while qualitative designs will include many variables, because context is of an utmost importance. So it's a kind of a methodological holism. And that can create sort of misunderstandings, and what is it that we investigate actually. So we can ask, is the object of research really the same? In what sense and at what levels? So I think projection for collaboration in the future is that inter implies a fundamental respect and tolerance for different epistemic cultures. Inter in healthcare research implies also, in my mind, a destabilization of institutional power relations and knowledge hierarchies. And inter implies a better research planning, both academically and economically, because inter collaboration is timely and costly and should be funded as such. So thank you for me. And I give the floor to Mehmet.
Thank you, Annette, for the presentation. Thank you very much. It's a really interesting concept explored there. Before I hand over to yourself, Mehmet, quickly, what I can do also is just quickly share one or two questions and points that were raised during Annette's discussion, which I think were quite interesting. I mean, from first of all, it appears that in terms of the definition itself, I think that a few people have agreed on the point that citizens should be included within this field. So things such as non-professionals, experienced patients and family, and that sort of thing. And I mean, yeah, from your side, Annette, what I'll do, if you can, I will share my screen myself, and then I'll put in, if we can now see the questions here that I will address to yourself. There we go. Yes, yeah. So what I'll do is, obviously, for the first question, I think we could examine for all of us, really. We can get Mehmet's input on as well. So the actual wording of interdisciplinary or interprofessional or interaction, what we could actually have as a solid definition. The wording itself, I think, is quite important. So I'd be interested to get people's thoughts on that itself. Actually, if we could, if anyone has something to add into that, and Ed yourself as well, of course, and Mehmet as well.
Yeah,
can I start then?
Yeah,
of course.
Well, actually, especially for collaboration, it is very understandable to use professional, because many professionals, some of the professionals don't have the discipline, so they don't feel that they belong to a discipline. So interprofessional collaboration makes a lot of sense for me. And also actually interprofessional research. But while I was preparing this webinar, actually I have seen in literature, mostly for research, people use multidisciplinary more than professional. And this I mean, if you are doing a research from a researcher side, you think that it should be a discipline inside there. So a discipline is a discipline. But a lot of this is mostly researcher-based definition. So if really wants, as many people said on the chat box, include the patients, for example, and other people who also feels that they don't belong to any discipline, it seems it's wise to use interprofessional. But still, I mean, we can debate that. I'm also wondering the others' thoughts on that.
Yes, exactly. Yeah. Well, what I can do also, if you'd like, is if some of the comments that we've got here, Stephanie, if you wouldn't mind if I started with yourself, just to get your thoughts on that, if that's okay. I'm not sure if.
Sorry.
There we go. Yeah. Sorry. Did
you ask something?
Yes, yeah, just to get your thoughts really from Mehmet's response as well. Just I thought if you had a few thoughts on his response, and also obviously sort of one of the two of the comments that were made in the chat box.
Yeah, well, I think it's just a question of definition really, and I don't like the interprofessional too much, because that excludes all the non-professionals that could be really interesting to be involved in research. So, and interaction, I think that means just more of well, that sort of closes in to a specific sort of action for me. But so I'm more of, but I'm not an expert in this at all. But I would like to have more this participation word into the research. But I think Esther might be more the person to answer this sort of questions, really.
Great, yeah, thank you. Yeah, and of course, as you said, I think it comes down a lot to definition and how people perceive the meaning of those words. As you said, with professional implies that then there should be some sort of profession that that these people participating should have. Whereas, yeah, citizens obviously wouldn't have a specific profession per se. But yeah, of course, if Esther, if you would, if you have any thoughts, I'd be more than happy to hear.
Yeah, yes, I can add something. I think the difference between multidisciplinary and interdisciplinary is that interdisciplinary much more focuses on the real collaboration and integration of thoughts together and discussing things together, while multi is just there are more professions involved in one way or the other. So I would really prefer interdisciplinary or interprofessional. And from a research perspective, it would be good if we could, somewhere in future, I think maybe it's too early, but find an inter-stakeholder way to include indeed the non-professionals, but the end users. We are running more and more projects with involvement from patients, patient organizations, really from the start. We now even are starting to run a project that is run by the patients and supervised by us as the researchers. So I think we should work with terminology that includes people as much as possible, but also that is feasible to get people in the collaboration. So, and then I think interprofessional or interdisciplinary, yeah, both are on the professions of the researchers and not on the perspectives of the patient. So that will be something for the future, I think.
Excellent. Yeah.
Exactly. Yeah.
Yeah, thank you very much. Sorry, just to just obviously just keeping an eye on the time here. We've had also one or two comments from. Sorry if I'm pronouncing this name incorrectly, but Chirikla has a few comments in the chat box there. I just wondered if you wanted to briefly just to give your thoughts, if that's okay with yourself. Then we can go on to some of the questions specifically for Annette. Okay, I'm not sure if I can we can quite hear through that actually. Chirika's microphone is on, but I'm not sure if that's working. But if in the meantime, then what I can do is we can come back to it if not. But then I'll move on to the questions, obviously, that have been posed to Annette. So Annette, if you would like to just give your response on the two that are on the screen, if of course you can see them.
Yeah, can you hear me? Do I have sound?
Yes. Yep.
I'm sorry, I'm such a rookie in this technology.
No problem.
Yeah. I really I appreciated the comments from the audience, and I think also it would be really interesting to sort of work on the terminology of inter when it also includes citizens, users, stakeholders of different kinds, because then it's something else, right? Something different from interprofessional or interdisciplinary. But with regards to the questions, is that number 2 and 3, right? Health professionals are also shaped by the culture of where they studied. So how can we make cultural aspects in our vocabulary? I'm not sure I understand this question, but what I said about the tribe is actually the epistemic cultures. It's about how you are trained as an professional or as an academic will sort of shape the way you go to collect your data, or the way you actually also the way you collaborate, and what you find useful and what you don't find useful. So, but how can we make cultural aspect in our vocabulary? I'm not sure I have a good answer to that, but maybe I can. It could be rephrased, and I could address it after Mehmet's talk as well. And why are the allied health disciplines not involved in these projects? They are executing a lot of care issues in the community. Yes, and that is totally true. So the allied in the project, sometimes when we make a project, it's kind of like who do you know who are interested in the issues that you are interested in exploring, and so on and so forth. But we have also occupational therapists. I think I forgot to write that in our project, and also physical therapists.
Yeah.
But I really agree that a lot of care issues they do in the community. So I wish next time I make a project, or I always try to include as many as possible, because I think it's important with all different perspectives yeah.
Annette, thanks a lot for saying that. And on that issue, I just want to make a small remark. It's Diederik. That is the beauty, I think, of the Primore project, Mehmet. I think there we are with bringing together those different professionals into these kind of projects. So it's a plea for our Primore project.
Yes.
Just having said that.
Okay, thank you. Yes, I appreciate it. And I will try to do better next time and include even more, because it's really important. Yeah.
Excellent, exactly. Okay, what I'd like to do now, obviously, is hand over to Mehmet, because I'm getting a bit wary, of course, of the time that we have. Çerekli, in terms of your microphone, you are unmuted, but it doesn't seem to be working. So what we can do after Mehmet's presentation, we can see if we can get it working again, so we can get your points across as well. But what I'll do for now, Mehmet, if I hand over to you, I of course can then make you the presenter, so you have the screen, and then we can go from there. There we go.
Yes. So I think you can see my
Yes, exactly.
The presentation. Okay. Hi, first of all, let me introduce myself. I'm a professor of family medicine working at the Marmara University School of and also I am a member of a directory board of Turkish Family Medicine Foundation. And working for a long time in the European, and I'm especially interested in health systems research recently. So involved in including quality and different dimensions of primary care, and also involved in some projects to, strengthen primary care in the last years. So what I would like to talk today with you about interprofessional collaboration in research is actually, I will try to describe the rationale with a little bit different perspective, and then I will try to make the definition of multi-professional research. So what is actually and what is not multi-professional research, and is it possible to critically appraise actually the multi-professional research, and how are what are the possible ways to support multi-professional research? So when we look at the complexity of patients we see in primary care, actually, then there are a lot of, aspects regarding the patients, especially if you think the increasing comorbidity and multimorbidity, together with the social determinants of health, then you have the morbidity burden of the patients. And also, if you add to that non-health related individual attributes, then you have a huge complexity. And in this complexity, actually, sorry for, I just try to find out a way to get rid of this right part of the screen. Sorry. Yes, okay, I can go now. Actually, then, to deal with this complexity, mostly it is suggested to have a holistic modeling, person-centeredness, comprehensiveness, primary care management, especially coordination, and community orientation. And when you look at these terms, it's actually very difficult to achieve all of them with only one profession or only one discipline. And then the integration, so the integrated of care. There's a very nice model just presented by Valentin and the friends actually. And here you can see professional integration, especially in the macro and meso levels. So when we are talking about the integrated care, actually we mean the professionals not only being site to site, but really interacting with each other and really communicating with each other and changing things for each other, and also on behalf of the patient. And there was a position paper on interprofessional collaboration from EFPC in 2012. Here, it is mostly said that the interprofessional collaboration in primary care is especially important to face the challenges of increasingly complex health needs in primary care. And also to deal with that, education of healthcare professionals is important, adapting human resources and the occupational structure, and also the skill mix in primary care is important. So in terms of these, how can we find out the best practices? How can we see, I mean, this practice is much more better in the interprofessional collaboration. Then we really need interprofessional research to do that. So with the research data only, we can deal with better ways of interprofessional collaboration. So what is actually an interprofessional research? If we think about an example, for example, a primary care doctor, and this doctor is trained in clinical epidemiology and interested in primary care service utilization and document the kind of health services they use. And these quantitative data would provide a useful overview of the incidence, natural history, and density of health service utilization among the target group. Then Jane planned to develop a complex intervention to improve the immigrants' health literacy. Then she thinks that they would maybe improve their health services, and she performed an RCT for that. And also she included a qualitative phase of this research, and she did some interviews with the immigrants and to see the experience of intervention actually. So how they find out it, and it's really with the increased health literacy, is there any, they can see any link between the health service utilization. And at the end, this intervention is measured by a closed item health literacy questionnaire, and also she has done some repeat assessments of frequency and the density of self-reported health service utilization. So when we look at this, could we consider this actually an example of interprofessional research? Actually, no, because this study plan seems to be quite naive and also paternalistic, unrigorous, and what is more, this could be called a little bit entropic. So actually, when we mean interprofessional research, we shouldn't understand only picking and mixing up different methodologies. So using a quantitative and qualitative methodology together, it doesn't mean actually that you are having an interprofessional research. So when we say entropic, it is actually a tendency towards increasing disorder lines and also there's an erosion what makes individual disciplines distinctive from one and each other. So if you don't have a critical reflection, actually, and also if you don't have, the conflicting and different knowledge bases of different disciplines, then it's really more fragmented, and you really do not add much knowledge from different point of views, but you can only look at from your own perspective of the events. So for a legitimate interprofessional research, two main concepts are important. One is the collaboration, and the other one is the contestation. So when we say collaboration, actually, professionals with contemporary, complementary knowledge, skills, and experience, they join forces together, and then they address a grand challenge that could not be only answered by one profession. And one of the examples is that could be Human Genome Project, where many different professionals and disciplines are working together. But again, the integration seems to be a very crucial concept here. So collaboration doesn't mean just being together and working on the same thing and just adding your opinion on that, but it is more learning from each other, learning from the concepts, and also learning from theoretical and methodological differences between the disciplines. So this should be a really interaction between the professionals in order to achieve a high quality interprofessional research. So also, this is the contestation is very important to transfer the ideas and also to stimulate the creative imagination, and also to guard against the fragmentation and also commodification of the knowledge. So high quality interdisciplinary contestation would be a critical engagement by all parties on an important issue that would not be otherwise achieved. So it should be such a contestation that, if these people do not come together, you cannot achieve these results. So if you define these two concepts, then you can guide actually yourself to critically appraise interprofessional research. Then you can ask questions like, is this project a collaboration? Is there a contestation in that? Or you would just classify it as an entropy, actually. Or what is the real synergy between the disciplines in this project? So how can you see the evidence for this synergy? And also achievable by ensuring that twice collaborating together with different disciplines. And then what is the evidence actually of the critical and reflective interdisciplinary engagement? And also significant revisiting of the assumptions. So how do they contest different contents and different knowledge together? And then what extent have the outputs been generated or enhanced through the input of more than one discipline? So if you can answer these questions, then and also give a positive answer to that, so this could be a really high quality interprofessional research. And when we look at the usefulness and the reality of interprofessional research in primary care settings, we know that to be successful in primary care, for the multi-professional research, it should be more context-based and sometimes pragmatic. So actually the research needs to reflect the complexity of the primary care, and but in this concept, we need to combine the pragmatism together with the quality. So we shouldn't sacrifice the quality on behalf of the pragmatism. And then the chaos and complexity could be used to find out more meaningful ways of exploring the primary care, different aspects of primary care. And on the other hand, the primary care organizations must really give a high priority to interprofessional research, and it needs the support and the facilitation. So how can research institutions support interprofessional research? First of all, universities do not seem to be traditionally designed to promote interprofessional research. So I don't know how it is in your institutions, but mostly all these departments are working by their own and with less communication with each other. So we need to change this a little bit. How can we do that? Well, first of all, we need the infrastructure for the management and governance of multi-center research. So there should be a collaboration. Then we should be able to manage multi-center research. And also there should be a supportive and enabling culture for interdisciplinary discussion and debate. So people should be ready to hear the other professions and disciplines' view and try to think and understand the view they are presenting, and also to understand the added value of their contributions. And also studentships and fellowships which cross-disciplinary bounds could help. And then we need active and major partnerships with other services and commercial organizations. And then actually human resources can reward interdisciplinary research. So when we are promoting people or allocating people, we can think about interdisciplinary. And then a few practical issues, how can be done. Actually, first, even in a primary care center, an idea can be developed initially inside that primary care center. And if there could be some local research networks which will help to that. And further on, the research idea may be progressed. And also, the research practices in the regions might have a supporting role in the neighboring practices with less experienced practices in research. And also, the many research questions important to primary care don't require that much financial or other resources. And of course, the main driver behind this research should be integrating the ideas that is coming out of the research projects into daily practice of primary care. To make the collaboration work, it is said that a shared perspective of what the problem is crucial, and it should be expressed by each individual of the team, and valuing the contribution of everyone is important, and this will create a sense of shared ownership to the projects. And finally, the time, training, and support. So we know that research needs protected time. So actually, the primary practices should make a part of their daily routine. A part of their daily routine could be research and research activities. Then it would be much more easier to have kind of time for research. And finally, there's another question: is what would be the research agenda? What would be on the research agenda of interprofessional research? Maybe some of you is aware. The EGPR and European General Practice Research Network has published a research agenda for primary care and family physicians, looking at these agendas of different associations. Maybe it would be nice to have a look and find out a core agenda for interprofessional research. And it seems that we can look at it in 3 different levels: micro, meso, and macro levels. And mostly interprofessionalism seems to be important in primary care organization, service provision, and also the skill mix of the primary care teams. So I have put some concepts and themes under these titles. So you could think about it, and I'm ready to and open to add any other concepts under that. So what could be the priorities actually? So this is an important issue to discuss and then start the research. And then here there are some questions that could be answered by interprofessional research. And I'm also welcome all of you to add questions here. These are the questions came up through the Primora project of a community health center. How to measure community orientation from multi-professional perspective. What is the optimal practice size for primary care, social care, and health care? How can we integrate them? How should care be horizontally integrated and coordinated among multidisciplinary teams? How can different stakeholders support and assist the primary healthcare workforce and successful team functioning? So these all seems to be areas to explore through interprofessional research, but really it's to be a rich discussion to prioritize them. So finally, I would like to mention Primora. So most of you know it. So this is a project we are in to build up a primary care multi-professional research network. And this is also working in an online platform called Pi. So to discuss further, I think from this webinar, we can continue our discussions in this platform, and you can put your ideas, problems, and experiences regarding interprofessional research in this platform further. Thank you very much for your attention. These are all that I would like to say for today.
Fantastic. Thank you, Mehmet. That's a brilliant presentation there, and some really interesting concepts explored as well. What I will do for now, of course, I will then share my screen as well, because then there were some potential questions that yourself and Annette could answer. So what I'll do is I'll just take that on here for myself. There we go. Okay. So Mehmet and Annette, obviously between the two of yourselves, if you'd like to then yeah, pose an answer to some of these questions, if you have a thought on them. Just to double check, you can see my screen on there, can't you? That's popped up.
Okay. Can you hear me now? Or?
Yes, yep, I can hear you.
Yeah, because I were muted. So yeah, thank you, Mehmet, for a nice presentation. So maybe I could try to address question number 1. It seems interdisciplinary asks for a view of human from a very holistic perspective. Yes, I think so, and that was also in one of my slides when I showed you the sort of the different models of a human in the different sort of epistemic cultures. So if we could manage to combine all these different epistemic culture to produce a holistic understanding, I think that is what we strive for. But in our research practice, it's challenging because we sort of carry with us different understandings of what is a human, what is a society, what is a social phenomena, what is primary care. So, and I think it's interesting to explore these issues, but it's also challenging in research practice. But I really agree that interdisciplinary asks for a holistic perspective. And should I address number 2 as well?
Yes, yeah. If you have
maybe
also Mehmet
if Mehmet want to address number 1. I don't know if Mehmet has.
Yeah.
Do you have?
There was a bit of an issue there, I think, with his microphone a few times during the presentation as well.
Because I couldn't hear everything. Oh no, he disappeared.
Yeah.
No.
He's rejoined, I think. So if he
okay.
In the meantime, Annette, if not, if you could, maybe address question number 2, and then if Mehmet manages to get back on, we can, I'll go back to that
so so what inspires me in a multidisciplinary research is actually what it could be, what the synergies between different points of views, between the different ways of approaching a problem. So the challenges that I have been talking about, these are also inspiring, and also as a social scientist moving into a field of primary care research, which is perhaps not dominated by medicine or by the sort of the hard sciences, but still sort of asking kind of the naive questions, perhaps also have a look at politics on the field of primary care. Sort of, I feel that when I can contribute doing these kinds of stuff, and other researchers, either they are nursing scientists or occupational therapists or whatever, I think that we look at the field with our different gazes, and then we come together, and then when we discuss, we have new ideas, and that is really inspiring, I think. So yeah, and then question number 3, how about simply integrative research? And I think for the conceptual discussions we had before, my suggestions were just from the top of my head, like interactive research, but integrative research is a good concept, and I just googled sort of the synonyms. It's consolidative or unifying, and that sort of describes actually at least one of the key aims of doing something together with other researchers and stakeholders. So integrative research is a good suggestion, I think.
Annette, can you hear me?
Yes.
Ah, wonderful. This is Harita. Yeah. I had trouble. I really, really loved what I heard. Both your presentations, Mehmet presentations, they were wonderful. I happen to have training in medical anthropology as my first degree, even though I am a physician. Following that. And the integrative is the word that I want to use, because integrative includes everybody.
It does.
And not just the people, but also the environment, the physical context within which, or the cultural context within which we practice. Yeah. And I really, I just put it out as a suggestion. I have to review your slide and see how we can move forward with this, because if I had one thing to say, from listening to all that you're saying, is that unless we get our act together in medicine to be integrative, we are going to not provide the help that we have the tools, the knowledge to, but more importantly, we are not going to discover new knowledge. New knowledge doesn't come just in the laboratory. It comes also from the field, from the way we treat people and how they respond. And that is something that we can only get by involving the people who are in the field, including the patients, the citizens themselves. And I think that's where we're going to be able to bridge the gap between the field that I want to discuss specifically is genomics, for example, and epigenetic factors, which is something that will change medicine. But epigenetics includes the very cell within which we live, the very environment. So I'm very excited about continuing all these things. And that's where the concept integrative came, because I don't think just integrative medicine, integrative life, integrative system, whatever we want to call it, but we have to include the system within which we exist, as well as all the sciences and all the citizens. I really, really enjoyed listening to what you have to say.
Yeah. Thank you for your comment. I agree. And I know also, I think I have it in a slide. There are some concepts, and also perhaps we could find some concepts in the new Horizon Europe discourse, which describes describe research involving all these kinds of different stakeholders. I've seen this concept of collaborative research, but that is kind of also maybe too loose because they can mean so much. So I really like this concept of integrative research better, because it says something about what is the aim of the research more than
That's exactly right.
to collaborate. Because so I would also like to engage more and to find a good concept. And maybe it already exists, but I I don't know about it yet. So yeah. So now I see Tom. Are you? Is it Tom or Mehmet sharing the screen?
Tom is doing it.
Yes, yeah, that's Diederik actually. He's just giving you an idea of our Pi platform with the new website that we have just launched, where we can upload these sorts of issues and then open a sort of open discussion online with this. So the web page that he's showing you now is obviously the new layout of everything there.
Looks good.
Yeah, so I think it's some really good points raised in the discussion that we just had. So I think if we could propose this on the Pi forum as well, and that way everyone can have a chance to give their input on it.
Yeah.
Yeah.
Oh, is this a new prison health? Yeah.
Yes. Yeah. Yeah. So we have a few new topics that have gone up there as well. Yeah.
Yeah.
But that's accessible via the EFPC website.
Yeah.
Ooh, I like the mental health one. We really need it. Nobody's talking about it in reality, but there, wonderful.
Exactly. Yeah. Perfect. Okay. Now then, if obviously we're just reaching towards the end, so I think if that's okay with everyone, I'll wrap up. First of all, thank you, Annette and Mehmet, for your presentations. Really interesting stuff. And of course, the recordings will be available via our website and also on YouTube as well. So if anyone wants to share that or rewatch and listen to some of the things that were mentioned again, as well as the presentation slides as well, you can request that and we'll put that up via our website too. What I'm also going to do just briefly, it was there at the beginning as well, is the poster for our conference in Ljubljana, Slovenia, on the 27th till the 29th of September this year. I mean, from the pictures as well, you can see it's a beautiful venue. It'll be a really nice long weekend, I think, there. So, and abstract submissions are still open. The deadline's the 1st of May, so you have some time for that as well. But yeah, once again, thank you everyone for attending. If you have any questions, you can go via our website or email myself at t.carter@euprimarycare.org, or again through our general email address info@euprimarycare.org. But for now, thank you to everyone, and enjoy the rest of your day.
Thank you.
Thanks very much. It was wonderful. Thank you.
Thank you.
Bye-bye.
Bye.
Bye.